Alo Minglava. Dini Puya the Soro mainly are the south of Prime Cavally. They may say Dini la poesia also video topic the cook be meet of Piobida. No? The Piome topic mainly for generality, Miazo, Alo ala clinician, including GP book. No Pidole or the medical female lonely. Lwin အကုန်လုံးအတွက်ကိုညွှန်းပြီးတော့ဒီ topic လေးကိုရွေးပြီးတော့ပြောပြခြင်းဖြစ်ပါတယ် CT ကိုပဲနောက်ဆုံးအားကိုးဖို့เนาะအားကိုးပြီးတော့မှအဖြေကိုပုံဖော်ခြင်းဖြစ်တယ်เนาะ modality ကတော့စောင်းနဲ့လေးရတယ်เนาะ initially ပေါ့ diagnose နောက်တစ်စီကတော့ CT ပေါ့เนาะတချို့နေရာကျတော့လိုရမယ်ဆိုရင်ဆရာတို့ MRI မှာဆက်ပြီးတော့လိုအပ်တယ်ဆိုလို့ရှိရင်ရရတယ်เนาะအဲ့တော့ဒီ acute abdomen မှာဆိုလို့ရှိရင်ဆရာတို့ကျောင်းမှာစပြီးတော့သင်ခဲ့တဲ့အပိုင်းပဲเนาะအရေးကြီးဆုံးကတော့ history နဲ့ physical examination เนาะအဲ့ဒါပြီးတော့မှဆရာတို့ laboratory analysis တွေလုပ်တယ်ပြီးတော့နောက်ဆုံးမှာကိုတင်ထားတဲ့ professional diagnosis ကမှန်တယ်မမှန်ဘူးဆိုတာကို imaging ရဲ့အကူအညီနဲ့เนาะဆရာတို့ultrasound လို့ရိုက်တဲ့ CT လို့ရိုက်ကြတယ်เนาะplain film ပေါ့နော်အဲ့ဒါတွေကဆိုတော့ routine လုပ်နေကြအဲ့တော့ acute abdomen ထဲမှာဆိုလို့ရှိရင်ဆရာတို့ကအဓိကတော့ဒီ၄ခုဆရာပြောတာတစ်ခုကတော့ perforation ပေါ့ perforation ဆိုတာက perforation ကြောင့်ဘိုက်နာတယ်ဆိုတာအထူးဖြင့် acute peritonitis ရတယ်အဲ့တော့ acute peritonitis ကဘယ်အခါမှာရလဲဆိုလို့ရှိရင် any hollow viscous perforation မှာရနိုင်တယ်နောက်တစ်ခုက as a complication of inflammatory bowel disease or cancer တွေမှာနော်နောက်က obstruction က small bowel obstruction ဖြစ်ချင်လည်းဖြစ်မယ် or large bowel obstruction လည်းဖြစ်ချင်ဖြစ်မယ်အထူးဖြင့် newborn တွေမှာဆိုလို့ရှိရင်ဆရာတို့midgut valvular ဆိုတာ quite common နော်ပြီးတော့ GYN case မှာဆိုလို့ရှိရင်တစ်ခါတည်းဆရာတို့ovarian torsion တွေရပြီးတော့ပိနေလာနိုင်လည်းရှိ now inflammation မှာဆိုလို့ရှိရင် non infection ရောက်လာဆိုလို့ရှိရင် common ဖြစ်ဆုံးကတော့ဆရာတို့တွေ့နေကြဖြစ်ကလေးတွေ young age group မှာဆိုလို့ရှိရင် appendicitis ပဲเนาะ acute appendicitis ပြီးတော့ဒီထဲမှာဆိုရင်ဆရာတို့မြင်နေကြ cholecystitis လို့เนาะ pancreatitis လို့เนาะ diverticulitis or even the ruptured ectopic pregnancy เนาะကလေးတွေကြတော့တစ်ခါတည်းဆရာတို့ဘာတွေ့ရလဲဆိုရင်ဥရောက်မှာပေါ့เนาะ necrotic enterocolitis အဲ့တော့ urology case ကြတော့လဲဆရာတို့ဒီ stone ပေါ့နော် urethral colic ပြီးတော့မှ infection ပေါ့နော် pyelonephritis စသဖြင့်ပေါ့နောက်ဆုံးကတော့ဒီဆရာတို့ vascular ischemia ကြောင့်ရတဲ့ pain တွေလည်းရှိတယ် example for mesenteric ischemia mesenteric artery or mesenteric vein occlusion စသဖြင့်နော်နောက်တစ်ခုကအစိုးဆုံးကတော့တစ်ခါတည်း leaking abdominal aneurysm or rupture aortic aneurysm အဲ့ဒါတွေကတစ်ခုနဲ့တစ်ခုဘာကြောင့်သူ့ပေါ့ဆိုရှာလို့ဆိုတာကအဓိကတော့ဆရာတို့ main emphasis ကတော့ CT ကိုပြောပါမယ်နော်ပထမဆုံး perforation လို့ထင်တယ်ဆိုလို့ရှိရင် perforation ဆိုရင်များသောဖြစ်တာ hollow viscous perforation ဖြစ်တာများတယ်ဆိုတော့အနည်းဆုံးဆရာတို့ကတော့ free air ကိုကြည့်မှာပဲအဲ့တော့ free air ကြည့်ဖို့ဆိုတာကနော်အဲ့တော့ပထမဆုံးCT မရှိတဲ့နေရာတွေပေါ့ဆေးရုံတွေမှာပြီးတော့နေတွေမှာဆိုလို့ရှိရင် plain x-ray ကိုပဲအားကိုးရတယ်နော်အဲ့တော့ plain x-ray တွေကဆရာကပြောတဲ့ perforation ရှိတာတို့ unitrax တုံးရှိမရှိ bowel obstruction ရှိမရှိနော်ပြီးတော့မှ foreign body ပေါ့နော် intestinal ရှိမရှိစသဖြင့်ပေါ့အဲ့ဒါတွေက initially ကတော့ဆရာတို့ plain x-ray နဲ့ပဲ diagnose လုပ်တယ်နော်အဲ့တော့အခုကြည့်မယ်ဆိုလို့ရှိရင်နော်ဥပမာ free air ကြည့်တယ်ဆိုလို့ရှိရင်ဆရာတို့အများအား upright chest ကိုရိုက်တယ်နော်ပြီးတော့ဒါမှမဟုတ်လူနာကမတ်တက်မရနိုင်ဘူးဆိုရင်မတ်တက်မရနိုင်ဘူးဆိုလို့ရှိရင်ဆရာတို့ lateral decubitus နော် view ကိုယူတယ်အခုတိုင်းပေါ့နော် liver နဲ့ chest ပေါ်ကြားထဲမှာလေနော် air ရှိမရှိပေါ့နော်ဒီကြားထဲမှာ air ရှိမရှိဆရာတို့က lateral decubitus ယူတယ်နော် at least if you have minimum of 1 ml of air ရှိတယ်ဆိုလို့ရှိရင် you will see free air now if you take the upright chest or lateral decubitus တခုတော့ရှိတာပေါ့ upright chest တဲ့ဆိုလို့ရှိရင်လေက guest up here, so you have to wait for about 5 minutes standing to give a chance, for the air to rise, underneath the diaphragm, or between the lateral chest wall and liver. Okay. The next one, CT. Don't need to wear, not in CT map. It's very easy to see the free air here, in CT. Now to cook up what we call it the double wall sign. Double wall sign. The double wall sign is a free air power you appear my your a doing my your age is so the power free wall, no person no, that indicates that there's a free air. Okay. Details my solution Adika free energy there, no? Free energy, not to cook solution, or a contrast be like the see that there's a leakage, there's a hole in the stomach, where you see the leaking, the contrast here. So that suggests that this is the area where the perforation is causing the free air, in the abdomen. Not to cook up deep protein. This is another example. You see the free air here up here, and also in oral carton, you see the leaking contrast. So this also gives us the diagnosis of perforation arising from the stomach. Dr. Kuka, we are looking as I mentioned before, but also we have to look for retroperitoneal air. This is the air located at the retroperitoneum. Especially, you see the liver here, you see the air along the lateral border there. In this location solution, maybe there may be a perforation of the duodenum. So by seeing the free air retroperitoneal air or free peritoneal or free retroperitoneal air, by looking at the location, you can pretty much tell, origin air. Not to call obstruction. Okay, obstruction. I mentioned about the stone obstruction. There is still obstruction there. The stone obstruction. The advantage of CDR is going to be that some young point about the Chabaja, the pain at the Surada, another diagnosis of young. Stone are claimed my solution, several mini Jave, the stone, Kajavish stone, Mohammed, flavor pitching, stone hotel Mohammed. Dimension I the Kajal, you see the stone obstruction causing the dilatation of the left ureter here. Same as here there. Now, when you do the IVU, usually you won't see the ureter straight like this, all the way down to the bladder. Usually, because of the peristalsis, you see the ureter is interrupted. Dinama contrast or dinalima contrast in the you don't know downtown so that you know that there must be something obstructing down there. So this is the diagnosis with the IVU. So shadow name as a CT machine, so IVU that's all we have before. So CT channel lower it, I don't know first she there, stone a ureterocycle junction machine, that axial view, that coronal view, use a sagittal view. This is the stone infection there. Not to go out, stone and fibrillar outside of blue solution, stone solution, stone infection sheet the solution, it's out of Pia Unita, and then they do a walk a edema yard. Edema sheet of you see a little tissue around the stone. You see a little haziness, soft tissue around the stone. This is the tissue rim sign. So that shows that this is the probably this is a stone, not the fibrillate. Okay. Not the Kuga, In this particular case, you see the nephrosis on the left kidney there, and you see there's a little stone infection there at the proximal ureter with a little soft tissue, right? Okay, next. Okay, now this is a case. Okay, okay. So this particular case, I just want to show you the stone here on the plain trim. And you see there's something going on in the background here, the soft tissue background. But when you do the CT, you see the stone here, and also you see the kidney, no, filled with gas. No? So this is a case of stone infection with emphysematous pyelonephritis. This is a very simple case. Now, when you see the CT with contrast injection, you see this contrast density is very heterogeneous in both kidneys. So that shows that both kidney has a pyelonephritis, now both case 1 and case 2. And at the same time, you see that a little induration of fat. We call it dirty fat, no, around the kidney there. That shows that there's inflammatory changes going on in these kidneys. Okay, next is the obstruction there. No? Obstruction CD လုပ်တယ်ဆိုလို့ရှိရင် underlying cause ကဘာကြောင့်obstruction ရလဲနောက်တစ်ခုက obstruction မရှိဘူးဆိုလို့ရှိရင်လည်းတခြား alternative diagnosis ဘာလဲပေါ့နော်အဲ့တော့ဒီ CD လုပ်ခြင်းအဖြစ်ဆရာတို့ even acute cases solution, surgical case solution, at least this is the road method of your surgery the pre-op planning. Planning low yard the sheet at the jumbo acute abdominal solution diagnosis so low prima surgery no. This is the normal gas pattern here. And the one on the right, this is the, we call it the every level, step level pattern. Now, this is a sign of obstruction on the plain X-ray. Now, when you see this one on CT, the good thing is, you know where the site of obstruction. That means that non-dilated and dilated bowel junction, Bama sheet is Sorago, Sero Shallow Yard. No, decrease my solution. You see, this is the area where the non-dilated and dilated junction is. So that shows that the site of obstruction is somewhere around in this area. Particularly in this there is a little okay. No? So one
yeah, a good count Jarvis, yeah.
So in this case, you see this, there is a closed obstruction due to adhesions here, no? So you know that by having the CT, you know the general site of obstruction and also the cause of obstruction there. Okay? Next one, this is very obvious there. This patient is there's an obstruction here, but he has a very large inguinal hernia. This is strangulated inguinal hernia causing bowel obstruction there. No? In this case, also done with the dilated, loops of bowel here. But when you look down here, there's the obstructed, strangulated right inguinal hernia there. Okay, this is another case, especially in the older people. In older people, where you have the very redundant mesentery. In this case, the sigmoid colon is swing around, and it got a volvulus causing obstruction. There, this is the sigmoid volvulus. When you give the rectal barium, rectal contrast, you see there's a narrowing where the mesentery is twisted around. Okay, so this is the sigmoid volvulus there. Next is mid-gut volvulus. Now, mid-gut volvulus usually is a complication of bowel mouth rotation there, and most of the time you see in the children, neonates and children, this is quite common here, and they present with the failures of vomiting there. And look at this one now. You see this mesentery, and you see these vessels, SMA and SMV. Now here, there, no, they are usually SMA, SMV are aorta machine, IVC machine. Now they are located to the right. That means that this patient has a very redundant mesentery. The mesentery are shallow. Now, whole swing like, the swing like low data. So, what does that appear? Swing low, and twist fit on. Twist fit on you got the valvulus, no obstruction, no. Daga, we call it a 4-2 sign. So, no, ye, no, papale, no 4-2 sign. So, you see this, no, this indicates that this is a patient with the small bowel obstruction. That is a mid-gut obstruction there. And you see this, no? Then you twist fit the solution. Normally, no, Saroga, aorta SMA sheet, IVC shema, the SVC, or the vein sheet, superior mesenteric vein sheet. Then me elomio, or twist fit the solution, SMA, Yabaya, SMA, Pebako Yapan. And I could trace the solution. That is one of the clues. We call it inverted SMA-SMV relationship. Because twist fit the position, no? And two findings are valid. Gonna be a time here. What sign of twist mesentery, no? Mesentery to do bowel, no? Now the kuga rotated bowel rotation to a man. Now to go SMV rotated down and position, and also you see this obvious dilatation of the bowel and posterior necrosis power, you got perforation and you got the free air there in advanced cases. Now this is a recent case. You see the date here. September, no? This picture I want to show you. No? 85. This patient is 85 years old. No? People you dilated colon solo. People colon, normal colon was a piara that did no? They were dilated bowel sheet. Just one big one. No? Axioma, one big one. The Mathupian Batuya, Dimachicha, SMA, SMV, the Messenger, the young, Yabako young, to normal position, Mahobu, not the Ayon, or the Amati Versa, the Versa, Gona di Ego, Trace Solution, Dinama, Dama, every level to be pure Dima Papia or January. No, not no feel over January, Dima. No? Now, what was I? Hope you know. Dima versus the Aoyang maybe. No? So this is a case of also mid-gut valvulus. You see this? I want to show you this SMA origin, no? Water, no? So normal so SMA Dima red needed. Hope young water so mesentery shilo, loose pillow, mesentery swing load and then artery like your pa water. So Dima artery, vein, the Aoyang labi. No Dima or Wabu, no sign, edema. So this is also recent case. I got it, in older people, elderly people. So elderly people in the Canadian, but they may. So Lugina, another picture that put up your sigma vulgus are a miasm pitting, no Canadian Jaro, could not be there, or the bigger vulgus are clearly my poor video communicated. No, now the cook are interception, no. In the perception, clearly my solution, Miana Picala, lead point unknown idiopathic 95% lymphoid hyperplasia of pita, only 5% love a Macus, Damare, Polypija, Damule, Jubilean 6 kilo clearly in the perception yard. A Georgia, the specific cause usually lead point at Chumaja, no Chumaja. Interception yard. Idiopathic are rare, not only 20% of a sheet. So sorry. So this is a picture there. The Apienga da Sikam, no? Dima ilium. Hodola. Apienga we call it interception local there. to a recipient of interception. A tail when very Utheliga interceptum. No, a deep on time, or gonna be a second ego, small bow when you're so one. Okay, no, so them about the say, fatty part on my vessel in a part one. No, diet or picture book, no, to your drawing book. Clearly, my say, or they may intercession to a trial to pure, no, but let's say abdominal pain alarme, now the red current jelly stew palme, now to go sunlight abdominal mass palme. This is typical for interception, no, in plain diagnosis, no, clinical diagnosis. Okay, now to go up. Hello, they might say not being animal. What a contrast and my look is saying, Dima, how can they be about Lavido or dinner? So we call it the crack operations there. Not to go out to Kadian Batwime, Unakujadama contrast with what is saying, it looks like a fine spring appearance. Now, this is the being animal examination. Daga before reduction. Daga Sado, the variant Tevio, variant Echo, Nenelli, me like the Thomiro, maybe no pressure linet, a la piamiro, don't talk at the wall. So now so pian taught the normal pian pit. No, that we made Dilua, recurrent pian yan and the Takayabui. So that Daya be let the Kushi Daga, that European piano prevent the Kuba bow anchor lobium. Otherwise, it will recur. No. CD Jimmy, no? CD Dibonji, no? Or the Daga Bonji, not Diba. No, Dibonji, Ujin, Nala, Tani, Piro Elema Feti Padore, Vesari Padore, or Corona Jara Po Vido Miare, Apima Ushide, Atea Uala Wimora. So this is the typical images for interception there. No, interception seeking small bowel pitching lepime, Tamamaho, no, small bowel changing lepime, the budget donately $2, no, Dima, no, Dimaji, no, Diponji, ilium, small bowel changing, no, hello, so on. Hello, Baja so the less of all. The Bawa Nakuga, the Kunatuga perisources, speech in Matulo. Anauka, no, Anauka Uga perisources, Miano, a sheep Ugo to a Wabido with Warabo, to a Pimian, to perisources, to a Baja of Pimian, to a reason she, but the two Tama, Chuma Shime, Rigi. Kalima say, publicly, Shime so ye, nature the particle, Melodian to a piano squeeze low token. Bawan in 12 one you got squeeze low token. Now to a squeeze low door, speaker mea no, a she did Udel to a Flavido win so far to jump. No, that's the reason for getting into interception. Okay. Next, inflammation. Inflammation, thousand times, so goblet solution, that he got low no modality, no. Diga or Saros, you with one. The plain experiment, no, Miare Harry. They may the Gosoniga or 100% Miabu, no, even CD man 100% Miabu, CD manama 75% Miare, Goson. No, so it depends on 2 years or composition of a material, to my carbohydrate para, calcium para, bilirubin, no. Pigment bella, other people, no, cholesterol bella, fat bella, so any form of multivioma, so minimum mutual pillar. So the plain experiment solution, only 20% of a minute, no, a column may have Dima CT, not CT, Dima classifies on Mia, Dimaga, fatty parastone, other cholesterol stones. Cholesterol stone 10% of she pigment still 10% of she pure mixed down 80% of the time a mixed down cholesterol, bilirubin, calcium carbonate, the thong powder, not the thong powder pita. Not to go up so pure time, the cost of 20% me X-ray, but CT 75% of me not 100% correct, no 100% Error the choke thing, city loaded, baby made the other tones and time a little yet composition multivio mahala, below 100% leather boa, no? Cholecystitis got about 90% of the time a stone up shida, no? Stone irritation, not to cook a calculus infection, up shida, no? A calculus of emphysematic color infection, up shida. Now to go a chronic pitwara, repeated cholecystitis or chronic pitwara. Dima poara city, ma mere stone jar, stone sheet, wall thickening a sheet, dima induration around the gallbladder, dima la gallbladder wall, and a thick pit, be a fatty and then a dirty shit, a dirty fatty. We call it induration of fat. Those are the signs of infection. So this is the case of cholecystitis. Now to cook emphysematic cholecystitis. Brain famous, so did I gas in it, no? Outline me, Dima city, my gallbladder filled with gas, no? Now the Kuga, Tibeka perforated acute cholecystitis, not perforated wabi, no? Dima bapidwale, abscess epidwabi. So those are the complications, no, from the acute cholecystitis. No? Next, pancreatitis. No, pancreatitis are usually a gallstone job or alcohol job. No, less commonly post surgery. Surgery, major surgery, post-op complication in a pancreatitis yadate. No, pure ERCP low pancreatitis yadate. Fakali so pancreatitis yadate. Now to hypercalcemia. Hyperlipidemia that can cause pancreatitis there. Now, Bebeka Ponga, normal pancreas, Lololi, no? Dimaga pancreas and NLE G, we are fatigued and NLE induration pit. So this is a mild pancreatitis. Now, this is a moderate, okay, and this is a severe pancreatitis. So there's a different degree of the infection, okay. This on the left side is a pseudocyst. So it's very commonly you see this pseudocyst of the pancreas. No, sometimes you might see a little bit of hemorrhage or hematoma inside the cyst. Okay. Now this is the pancreatic abscess. No, it's a worst case. No, it's a serious case. It becomes an abscess there. On plain film, usually we used to do this one, or the orabinium. Upper GI my lateral view, like this way, you see there's a wide distance between the spine and the stomach because the stomach now my lesser section, lesser section fluid in a fill up pseudocyst in a fill up it pushes the stomach now forward so the so the number fluid the stomach shit is that will drain out that low letter who also drain the upper like this stomach. Okay, next common, no, appendicitis. Appendicitis clearly, no, young pancreatitis are common there. No, dietary measurement, no, normal so in blood to other people. Okay, now, remember, no. My lotus and Kajalis appendix, I feel up here. So there are normal appendix, no? Dimara stone there, we call it appendically, no? Dima pony, no? Appendically, no? Horoma solution, Zaro CT, right? Machine, Zaro Ketoma, appendicitis of clinic reader, Sunday, okay, Mathejaloshi, and a pay like that, and my pillow. The appendix go contrast solution, then we call it appendicitis sheet, so we don't know element conclusion, sway and who to chain over, element located or educate their long and okay. Next, no appendicitis, they must only be a war induration, war thickening sheet. Induration sheet, not fatty, not young induration, and you see this, not enlarged appendix and dirty fat around it. So this is the typical acute appendicitis, no? Appendicitis, no? Appendicular mass, no? Upon omen, then just the Okay, acute abdominal larvae out like that nature or a disease or spread so you know out like that you get a big mass there. We call it appendicular mass. Not the Kajaloshi, the Vapilla, power rupture pit there, the Katia Mapilla, abscess pit. No, the acute appendicitis is a complication. These things, Dilomum picking, where were you? Dilomum pit so now, Moloera, that's why mobility lavi, drainage to be by a container. Hello, show lavi. No? Okay. Now, diverticulitis. Diverticulitis Sharon Nangama, diverticular disease are very rare. But Nangajama, no, Sharon American solution, diverticulitis are low GI or GI, about 30% of patients has diverticular disease. No, but diet out there, 2 days out there, no, diverticular disease are very common. No, there are demographic common. Any diverticular disease about 10 to 30% are diverticulitis yata, not diverticulitis. No, most common psychoid sigmoid colon. No, there are diverticulitis got Kajalush, that you can tell one. Mama Pamalo Samlu, no young. Appendix of youngness and Koyama. Or diverticulitis Yalushi, Quavomalo, which of my cases are inflammation, oil. Not to cut operation yana there, 2 Nicola. Abscess yarn, that to a complication. No, the margin diverticulitis. How do not? See the diverticulitis. No, I'm diverticulitis. Here to be matella. A young middle tissue rhyme she did. Not the sigma collia bema tissue she. That's we call it acute diverticulitis. No, acute diverticulitis. Okay, now the diverticular abscess so warm. No diverticular abscess. Now to go posoda vale fistula. No colon bladder ne fistula yawabi. That's a complication of diverticulitis. In conclusion, no. In conclusion, okay. Now conclusion, early diagnosis are low rate. No cause of acute abdomen low rate, feeble low rate. You don't have a proper treatment. CT is one of the modality, no, to diagnose for acute abdomen. There. Not to go on up there. Delay this way. Back out the lunar. Not complication. Not to cook a Ilomio investigate a piece of machine in a Macquarie, where the Luale. How do I? Quite be my Adam home penny, the war. Or Cotenata chap, like Doma, the champion here, or Lunadra Macau. Hope you know. Not a cougar. If you are suspicious for perforation, if you are suspicious for obstruction, if you are suspicious for bowel obstruction, or you don't know what is going on, get CT. Just do CT. Okay. Okay. Dr. God, Chinglishi does a case it Nakupia in it. No? Finding out about it, Dima Kalili. No? Sabe Piolame. Balloon, Bologna, filled with gas. But how much is no gas? The common how much gas machine? No, there's no gas in the remaining bowel. I don't know. Hello. That was single bubble silo core. Pyloric trees, pyloric leading the same. Not the cool. Next case. Diba bologna filled with air, stomach, dilated stomach filled with air. But you see some gas out there. Hold on. Gas in here is all the low people that hold on. Partial see single bubble side plus gas in colon. Diagnosis of pyloric stenosis. Okay. Not the good finding. Bologna alone. No? Polon alone, demand alone. Hope you know. Era baleda, double bubble sign. Oh, ama check Ashila, Mashibu, ama Emishibu, Era Emishio that Jodino, a trees yard. Hope you know. Era diet, say a year jebel. No? Say a soda, Poti Potalu, Coram, oh, the vehicle, Tuta Pota, Lanyo period to go, say a look. ဟုတ်တယ်နော်သင်ပေးတဲ့ဆရာကတပည့်ကပို့တော်မှ next generation တွေကပညာမလျော့သွားဘူးပေါ့ဟုတ်ဆရာလောက်မသိဘူးဆိုရင်တပည့်ကလည်းမသိဘူးဆိုရင်နောက်တော့သူသင်လဲတဖြည်းဖြည်းနဲ့ level ကျသွားမှာပေါ့သဘောဟုတ်လားဆိုသင်ပေးတဲ့ဆရာကလမ်းညွှန်ပေးရမယ်ကိုယ်တပည့်တွေတော်တဲ့တပည့်တွေအများကြီးရှိတယ်ဉာဏ်ကောင်းတဲ့တပည့်တွေ brain ကောင်းတဲ့တပည့်တွေအများကြီးရှိတယ်ဟုတ်လားကိုကပဲညံ့လမ်းညွှန်ပေးလိုက်တာပဲအဲ့ဒီတပည့်ကတော်လာမယ်ကိုယ့်ထက်ကိုတော်မှသိကြတယ်ဟုတ်တယ်လားဒါဆိုလို့ရှိရင်ညွှန်ပြရဲ့ဟဲ့လားဟိုခုနပြောတဲ့အကျိုးကျေးဇူးနော်ဒါတန်တယ်လို့ဆိုရမယ်ငါတက်လို့ကဆရာဆိုပြီးတော့အဲ့လိုမဟုတ်ဘူးတဲ့နော်ဒါဟိုဒီမဲ့ခံယူချက်ဟုတ်ပြီနော်ဆိုတော့ဆရာရဲ့ topic ကတော့ဒီလောက်ပါပဲဒါအကုန်လုံးပဲเนาะအားလုံးကိုကျေးဇူးတင်ပါတယ်เนาะ thank you very much เนาะ